CEO and founder of GCD Medical Supply and the co-inventor of the Georgie, the product that you were about to trial and implement into your health system. The Georgie was developed because and inspired by my daughter, Georgia Claire Bowen, who is the namesake of our company, her triumphant fight to good health after being a neonatal heart transplant recipient in 2018. During that hospitalization, I worked with the doctors and nurses at Boston Children's Hospital to develop a product that could replace the hospital Johnny, which is really just a shrunken down version of an adult hospital gown. So we worked hard to develop a product that could house all of the peripheral components of care in a safe way for these tiny patients. First, I just want to show you that when you take it out of the packaging, the Georgie will look like this. The best way to put it on the child is to unbutton it completely. You could leave these buttoned if you wish, but if the child is, really ill and it's important to not really move them if they're, unstable in the sense of blood pressure, we really tried to think of everything to try to not disrupt the child as much as possible. So you would like to lay it out flat. Here we go, we have our patient right here. We're laying the Georgie out flat and we're just lifting the patient on to the Georgie. As you can see, this patient has a feeding tube, a central line, and a peripheral line. I would start with securing the legs first. So you're gonna wanna button up the legs. The reason we did snaps instead of a zipper is because it allows for tubes and wires to be fished out through these tiny openings. And also the plastic snaps are MRI, X-ray, and CT compatible, which is disrupting the child less from dressing and undressing. So after you have snapped the legs, you can then move on to the arms. Here is the central line, the child's right arm. So you will carefully place the Georgie over the central line. This is a very smooth, soft, and stretchy fabric. What we've done in the Georgie is had a lap over at the shoulder, so that allows for safe placement of the central line to be out of the way. So you just really place the central line in the lap over and keep it away from the child. Then for the peripheral line, again, the stretchy fabric goes over the site very easily, and the line is then fished out at the sleeve. So depending on the child and how sick they may be, you can either snap the Georgie right here. There's a little tab where it snaps, and then wrap it over, snap the top and snap the sides. For some of the sicker patients, or maybe patients who are sleeping and you have to get vitals and you don't want to disrupt the child, you can leave the Georgie open and just kind of wrap it like a swaddle. You also have one of the best features of the Georgie, in my opinion, after having a child with a feeding tube, is we have a dedicated hole for the feeding tube right here. So you can fish the tube out of the Georgie. We also have thought of other peripheral components of care, like the heart monitoring wires that you place right here. The wires can be fished out right here. There is a snap, but the wires fit right through here, and it really keeps them in one spot, prevents them from being dislodged from the chest. Another great feature that we've thought of with the Georgie is if the child is going in for a procedure, or if they're just too sick to lift and to dress, but the family insists on the child being clothed in some form outside of just a blanket. You can use the Georgie as a gown. So it's just, you flip it in the opposite direction and you place it over the baby, and it actually just acts like a blanket or a gown, and it can kind of hide everything else that's going on inside on the child. And I think that is it. Thank you so much, and good luck with your implementation of the Georgie.